You think a unified Europe means a unified price. You think, tearing down physical borders tears down economic walls. Well, you are completely wrong.
Oh, completely.
Welcome to the deep dive. Today, we are taking a scalpel to the European Union's pharmaceutical market. And what we find underneath is going to shatter your entire understanding of how medicine is priced.
It really is. We're looking at this classic, incredibly data-heavy paper. It's from the National Bureau of Economic Research. The authors are Timur, Picone, and DeSimone.
And our mission today is to uncover this invisible, multi-billion-dollar war. A war being waged over a single, tiny heart pill.
Right, because it is a trillion-dollar life-or-death market. You have multinational pharma companies playing geographic chess. You have national governments fighting to protect their budgets.
Yeah.
And you have these gray market traders moving millions of boxes of medicine across borders. It's this silent game of leverage.
And the crazy part is, the battleground isn't some experimental new cure. It is the basic daily medication keeping millions of people alive. And you, the listener, you are caught right in the middle of it. Think about the European Union. They share a currency.
Right.
They erase their national borders.
Yeah, goods are supposed to flow freely.
Right. Yet they cannot unify the price of a tiny little pill.
No, they can't. Across an invisible border, the exact same medicine, made by the exact same company, can cost 5 times as much.
Which defies all logic.
It defies the very concept of a single market.
So why should you care? You need to care. Because the price tag on a drug isn't just a mathematical formula.
Not at all.
It is a reflection of how governments value your life.
Yeah.
It reveals how massive corporations manipulate the physical size of a cardboard box just to make billions of dollars.
And it absolutely proves that the idea of a free market in medicine is a total illusion.
To understand this, we're going to look at the data. Real hard data from this study.
Right. The researchers tracked 124 specific cardiovascular drug molecules.
Which is a massive data set.
Huge. And they tracked them for a decade, from 1994 to 2003, looking at the 5 major powerhouses of Europe: Germany, the UK, France, Italy, and Spain.
Let's ground this in reality for a second.
Yeah.
We are talking about cardiovascular drugs, heart disease.
Yeah.
This is the leading killer globally, and a massive killer in these specific countries. These are not luxury goods.
No, not vitamins you take when you feel like it.
Right. These are pills you must take every single day, just to keep your blood pressure down, to keep your heart beating, to prevent a stroke.
And that is a crucial point. The effectiveness of these drugs is often short-term. Like, if you stop taking your beta blocker, you lose the benefit almost immediately.
So you're trapped.
The medical term is that you are a captive consumer. You cannot simply opt out of the market because the price is too high.
Your life literally depends on this supply chain.
Exactly.
Which brings us to our first massive shock of this deep dive.
Yeah.
The life or death price gap.
Yeah, this is where it gets wild.
Let's look at the raw data, because at first glance, the data is going to lie to you.
First, we have to establish the baseline of what Europe was actually trying to do. The European Commission has been trying to unify this pharmaceutical market since 1985.
Since 1985.
Right. Their goal was incredibly ambitious, but simple on paper. Harmonize the market, encourage drug innovation, provide affordable, identical drugs to all European consumers.
Without compromising safety.
Exactly.
A beautiful dream, a unified continent.
Yeah.
But here is the massive slap-in-the-face reality. Same drug, same exact chemical molecule.
Yeah.
But the raw price in the United Kingdom is 5.3 times higher than the price in France.
5.3.
How is this legally possible in a supposedly unified Europe?
I mean, it sounds impossible.
Right.
But the raw data just screams it. Picture a blank white canvas in your mind.
Okay.
Now draw a graph on it. We are looking at the raw price lines for these heart pills over that 10-year period.
Right.
If the market is unified, those lines should be tightly woven together, but they aren't.
The lines are flying apart.
They are completely diverging.
The EU's dream of a single market looks like a spectacular failure on this graph. The UK line isn't just higher, it is rocketing toward the ceiling.
Let's get specific with the numbers so you can really feel the disparity. The researchers used a standard metric so they could compare apples to apples.
Okay, what is it?
They call it a standard unit.
So what does a standard unit look like to a patient? Like a physical thing?
It is exactly what you picture when you think of taking your medicine. It is one single tablet or one capsule.
Or single dose of liquid.
Exactly. One standard dose.
Okay, so literally one physical pill.
Correct. Now, look at the raw averages for that single pill across the 5 nations. The UK's average raw price was €1.36 per standard unit.
Okay, 136.
Germany was sitting at 60 cents. Spain was way down at 24 cents.
Oh, wow.
Italy was at 25 cents. France was at 25 cents.
Stop right there. €1.36 in the UK.
Yeah.
25 cents in France. For the exact same active ingredient, you are paying over 5 times more just because you live in London instead of Paris.
That is the raw reality. And over the decade of the study, that gap was actively widening.
It was getting worse.
Much worse. By the year 2003, the price wedge between the UK and Germany expanded to almost 200%.
That is wild.
Meanwhile, the differential between France and Germany dropped to negative 72%.
So the graph looks like a shattered window. The lines are just moving away from each other.
The market is completely fragmenting.
But why?
Because while the European Union makes the grand sweeping rules about open borders and trade, the individual national governments still hold the purse strings.
Ah, right. Healthcare budgets.
Exactly. They control the pricing mechanisms, they control the reimbursement rates, they run entirely different, incredibly complex health systems.
We really have to unpack this. You have 5 major countries, 5 massive, sophisticated economies.
Yeah.
All playing by completely different rules when it comes to keeping their citizens alive.
Let's look at the policy matrix the researchers lay out. It is a matrix of pure chaos.
Okay, lay it out.
Germany and the UK operate under a system that allows free pricing for new in-patent drugs.
Free pricing.
Yeah. When a pharma company invents a new heart pill, they can essentially charge whatever they want when they first launch it in London or Berlin.
I mean, they set a premium price to recoup their research and development costs.
Exactly. That's the argument. But France, Italy, and Spain do the exact opposite. They use strict fixed pricing.
So the state steps in.
Right. The government negotiates directly with the pharma company. They say, we will not pay a penny over this amount.
And they enforce it.
Forcefully. And they mandate periodic price reductions as the drug gets older.
Wait, I want to push back on something here.
Go for it.
If the raw data shows prices severely breaking apart and the UK price is skyrocketing while France stays flat, the single market is dead, right? The great European experiment failed.
Here is where the story takes a massive counterintuitive pivot.
Okay.
The raw data is lying to you. Your intuition, looking at those lines flying apart, is deceiving you. The market is actually quietly fusing together.
You are telling me a 5.3 times price difference means the market is coming together.
I am.
That sounds like absolute madness.
I know. But to see the truth, we have to strip away the disguise. We cannot just compare raw sticker prices.
We have to look deeper.
We have to look at the invisible anchors of pricing. We have to compare the quality, the presentation, and the hidden characteristics of the drugs being sold.
Which brings us to the next massive realization of this deep dive. The invisible anchors of pricing.
Right.
Specifically, dosage and packaging.
This is where you need to prepare to have your assumptions completely shattered.
Think about this. You would naturally assume that a pill with double the medicine costs double the price.
Right. That's basic logic.
If you get twice the life-saving chemical, you pay twice as much.
Yeah.
But you are wrong.
So wrong.
The real profit isn't in the chemical at all. The real profit is hidden in the cardboard box.
Let's dissect how the researchers proved this, because they didn't just look at the price tag.
Right, they used statistics.
They built a complex statistical model to perform what we can think of as a price gap autopsy.
A price gap autopsy. I love that term.
It fits perfectly. They isolated every specific trait of these heart drugs to see what actually moves the needle on the price.
And the first and most obvious trait is strength. The dosage. The actual milligrams of active ingredient that is actively saving your life.
Right. And as you said, human logic expects a linear relationship. Twice the chemical, twice the cost.
Right.
But the model reveals a terrifying truth about pharmaceutical economics. We can call it the dosage illusion.
So what does the data actually say about the chemical?
The researchers found that when the active ingredient in a drug increases by 10%, the price only goes up by about 2 to 3%.
Wait, let me process this.
Yeah.
I am a patient. I get 10% more of the actual highly engineered, life-saving chemical compound in my bloodstream. Yeah. But the pharma company only gets a tiny 2 or 3% bump in their price.
Correct. The elasticity is incredibly low.
That's wild.
Pharma companies simply cannot linearly scale their prices with the effectiveness or the volume of the chemical.
The physical molecule itself is not where their leverage lies.
Exactly.
That is insane to think about. The drug is the cheapest part of the drug.
It really is.
If the highly researched chemical doesn't drive the price, what does?
The cardboard box, the packaging side.
You have to be joking. You're saying the cardboard matters more than the medicine.
I am dead serious. Let's look at the variable the researchers call pack size.
Okay.
This is simply the average number of doses stuffed into a single physical box. The model found a massive negative effect on price based purely on the size of the box.
Translate the math into human terms for us. What happens when the box gets bigger?
The elasticity is negative 0.41, meaning if a package gets 10% larger, meaning it holds 10% more pills, the per dose price drops by 4%.
So a bigger box means a much, much cheaper individual pill.
Exactly. And this is where the distinct national habits of these 5 European countries create massive invisible price distortions.
How so?
Take Germany, for instance. They love buying in bulk. It is culturally and systematically embedded in their healthcare.
Okay.
Their average box of heart medication holds 84.7 units.
Almost 85 pills in a single box.
Yeah.
That's nearly a 3-month supply in one go.
Now look at Italy. Italy buys in tiny, frequent increments. Their average box holds only 28 units.
Wow. Less than a month's supply.
France is at 34 units. Spain is at 42 units.
So it's essentially medical Costco bulk buying in Germany versus airport convenience store pricing in Italy.
That is a perfect analogy.
But this isn't trail mix. It's manipulated at a massive national scale.
The Costco effect is real, even in life or death medicine. But here's the hidden weapon that pharmaceutical companies use.
What's the weapon?
Smaller packaging is, paradoxically, the pharma industry's ultimate tool for generating hidden profit.
How does that work? How do they use a smaller box to make more money?
By altering the physical box size, they manipulate unit prices right under the noses of government regulators.
That's sneaky.
Imagine a government pricing board forces a pharmaceutical company to take a price cut on their blockbuster heart drug.
Okay. The government wins the negotiation.
The company agrees, but quietly they shrink the size of the box.
Oh, like when a cereal company keeps the box the same height but makes it thinner so you get less cereal for the same price?
Shrinkflation, precisely. The overall price of the box looks lower to the politician.
Right.
The government gets to claim a victory, but the price per pill, the actual cost to the healthcare system and the patient, skyrockets.
They're playing a multi-billion-dollar shell game with cardboard, and human lives are the chips on the table.
The data proves this is happening. The researchers noted that price decreases significantly with pack size across all 5 countries.
And across all 10 years of the study.
Exactly. And the regulations inadvertently encourage this. In Germany, the co-payment that a patient pays out of pocket is based on the pack size.
Not the drug value, the pack size.
Right. In the UK, the maximum prices are regulated based on the maximum pack size.
So the government rules are literally written around the cardboard box, not the medicine inside it. That is wild.
It's all about the box. Let's move to the next major shock of this research.
Let's do it.
We're going to talk about time and geographic dominance and how in the pharmaceutical industry, the normal rules of business are flipped completely upside down.
Here's the thing that threw me. In the medical world, the old saying, like a fine wine, it gets better with age, is totally destroyed.
Completely.
And the idea of dominating the globe, expanding your product to every country on Earth, it actually makes your product cheaper.
Let's unpack the age factor first. The researchers looked at a variable called molecule age.
Okay.
This is simply the number of years since that specific drug was first launched in a given country. Now, the average age of the drugs in this study was 20 years.
20 years. So these are highly established drugs.
Very established.
They are proven to work. Their side effects are well documented. They are safe. In any other industry, a proven track record builds brand value.
Not here. The data reveals what we can call the age penalty.
The age penalty.
For every 10% longer a drug molecule survives on the market, its price depreciates by 2%.
It loses value just by continuing to exist.
Newer is always more expensive. Time is the absolute enemy of drug prices.
That makes sense, but it's brutal.
As more effective or even just slightly different new products enter the market, the relative therapeutic value of the old drug declines in the eyes of the payers.
So pharmaceutical companies are constantly racing against a ticking clock. Every single day their drug is on the market, it is bleeding financial value.
Which forces them to constantly push new variations.
Right.
They might tweak the molecule slightly or change the delivery mechanism. Even if the actual health improvement is incredibly marginal, they have to launch it.
Because new resets the clock.
Exactly. New justifies a higher price to the government boards.
Okay, that makes a twisted sort of sense. But what about geographic dominance?
The diffusion variable.
Surely if a drug is so effective that every single country in Europe wants to buy it, the price should go up. High demand across multiple borders equals high price, right?
Welcome to the penetration paradox. The researchers tracked a variable they called diffused molecules.
What does that measure?
This simply counts the number of countries in their 5-nation sample where the drug is actively available. The scale goes from 2 countries up to all 5.
And what does the model show?
The elasticity is negative 0.3651.
Meaning what, exactly?
If a drug manufacturer manages to cross borders, navigate 5 different regulatory agencies, and get their drug approved in multiple countries.
You would expect them to earn a premium for that massive success.
Instead, the wider the geographic spread, the cheaper the drug becomes.
What? Why would a company expand if it lowers their price? That makes no business sense.
The math is brutal. Being in more countries actively drives the price down.
Because of what?
When a drug enters multiple European countries, it falls victim to a policy known as international reference pricing.
Okay, explain international reference pricing. How does it work in practice?
Governments are constantly watching each other. France is looking at Italy. Spain is looking at France.
They're spying on each other's budgets.
Basically, let's say a drug company launches a new pill in France at a very high premium price.
Okay.
A few years later, they try to launch that exact same pill in Italy. The Italian government's pricing board will look at the data and say, we see what you charge in France.
Right.
We demand the French price, or we want it even lower.
So the lowest common denominator drags the whole average down.
Exactly. Success literally forces a price cut. By spreading across the European Union, the pharmaceutical company exposes itself to the most aggressive, tight-fisted price negotiator in the entire bloc.
Wow. So purely theoretically, a pharma company might actually look at a life-saving drug and decide to delay launching it in a poorer country just to protect their high price in a rich country.
The data strongly suggests that exact dynamic. It is a massive game of geographic chess.
That is terrifying.
They have to carefully sequence which country they launch in first, second, and third, because one bad negotiation in Spain can cascade and destroy their profits in Germany.
This is deeply unsettling. The mechanics of saving lives are being dictated by game theory.
Completely.
But it gets even more twisted. Let's talk about the concept of competition.
Oh, this is where standard textbook economic theory goes to die.
We all learn one basic rule in economics. Free markets promise that if you add more competitors to a space, prices will drop.
Supply and demand.
Right, they have to underbid each other. But in the life or death pharma industry, this law completely fails.
The researchers analyzed the variable of generic competition. This is the number of copycat manufacturers making the exact same generic version of the original heart pill.
So more makers should mean a brutal price war. Cheaper pills for everyone.
Let's look at the German market. Germany had a staggering average of 7.7 generic competitors per drug.
Almost 8 different companies fighting to sell the exact same chemical to the same German patients.
Now look at France, Italy, and Spain. They only had 2 or 3 generic competitors on average for a given drug.
Okay, so based on basic economics, Germany should have massively lower prices for these drugs. 8 competitors should have completely crushed the price floor.
But they didn't. The statistical models show that generic competition barely moved the needle on the original drug prices in these regulated markets.
The competition myth is real.
Very real.
How is that even mathematically possible? Nearly 8 competitors undercutting each other, and the price of the original drug stays firm.
Because you, the patient, are not the actual customer.
Right, what?
The government is the customer. The insurance company is the customer.
Right.
Think about how it works in Germany. The doctor writes the prescription. The patient goes to the pharmacy. The insurance pays the bill.
Right.
The patient does not shop around for the best deal on their heart medicine like they would for a flat-screen television. The normal, gravity-bound forces of supply and demand are broken.
It is a captive market.
Yeah.
The patient just takes what they are handed.
Exactly. And we must look deeper at the policies. Germany and the UK allowed free pricing for new patented drugs to recoup research costs.
Right, but France, Italy, and Spain did not. They used strict fixed launch prices and forced mandatory price drops.
Yes. France actually negotiated a single price targeted to the European Union average.
Okay.
Italy had a rigid mandate that generic drugs must be priced at least 20% below the original branded drug, by law.
If different nations are running completely opposite economic systems, free market versus strict state control, how can a single market ever exist? Who wins that fight?
To answer that, I have to show you an example of how tiny bureaucratic rules destroy markets and cost patients years of their lives. Let's look at what we can call the patent backdoor.
Walk me through it.
A tiny, almost invisible difference in bureaucratic paperwork forces French patients to endure high-priced patent drugs for 5 extra years compared to patients in Germany.
5 years.
5 whole years.
5 years of paying monopoly prices.
Yes.
Just because of paperwork.
Yes. Let's trace the history here. In 1993, the European Union introduced something called Supplementary Protection Certificates.
SPCs.
Right. The goal was noble. It allowed generic drug companies to start formulating and testing their copycat drugs while the original drug's patent was still active.
So they can get all their ducks in a row, do the science, and be ready to launch the exact second the original patent expires.
That was the goal. But here is the fatal flaw. SPC applications had to go through national patent offices, and the member countries interpreted the rules differently.
Of course they did.
In Germany and the UK, a generic company can formulate, test, and prepare their copycat drug while the original is still under patent.
So they are ready to go.
They launch the very next day. Day 1 of patent expiration, boom, the cheap generic hits the German pharmacy shelves.
Incredible efficiency. And what happens in France?
In France, national regulations forbade generic companies from even submitting the paperwork until the original patent had completely expired.
You cannot even hand in the blank form until the clock runs out.
Correct. And then the review process takes years.
Oh my God.
So that minor paperwork rule creates a multi-year delay. A literal 5-year artificial monopoly is handed to the original drug maker.
5 extra years of massive, artificially inflated prices draining the French healthcare system.
All because of a filing deadline.
This is infuriating. It feels like the system is rigged by red tape.
It is the reality of a fractured market. They call it a single market, but it is a single market in name only.
Okay. We have seen the raw data. We have seen the chaos of the policies. We have seen the massive 5.3 times price gap where the UK looked like it was being robbed blind.
Yeah.
Now it is time to perform the autopsy. This is where the researchers strip away all the illusions.
We are going to use a statistical scalpel. The researchers used a complex method called Oaxaca decomposition.
Let's avoid the heavy academic jargon. What does that actually mean?
Think of it like comparing 2 houses. You can't just compare the raw price of a mansion in the country to a studio apartment in the city.
Right.
You have to adjust for the square footage, the number of bathrooms, the age of the roof.
You have to compare apples to apples.
Exactly. Remember that massive, terrifying price gap we saw at the beginning, where the UK was paying nearly 200% more than Germany?
I remember.
Once the researchers stripped away the disguises, once they adjusted for the quality of the drugs, the UK was actually cheaper.
Wait. The raw data showed the UK price rocketing to the moon. It looked like a total failure of the British healthcare system.
I know.
It looked like the British public was being scammed by big pharma.
But the researchers applied their decomposition method. They leveled the playing field. They factored out the dosage size. They factored out the packaging side.
They factored out the age and newness of the molecule.
Yes. They broke it down to pure, naked chemical value.
And what happened to the UK's massive price bloat?
It completely disappears. Flips upside down. Once adjusted for quality, the UK was actually paying 10 to 27% less than Germany for much of the timeline.
Less. They were paying less for the medicine.
Yes. The UK wasn't getting scammed on the exact same pills. They were just eagerly buying the newest, highest dose, smallest packaged drugs available on the market.
I need you to really explain that dynamic.
Yeah.
How does buying new, small boxes make them look expensive but actually be cheap?
Think about the UK healthcare system's habits. They were rapidly adopting the newest innovations in heart medicine. They were prescribing the strongest, most effective doses.
Okay.
And they were dispensing them in smaller, more convenient packages for the patients.
Right, avoiding the bulk boxes.
Every single one of those factors, newness, strength, small boxes, drives the raw sticker price of the box up. But pound for pound, chemical for chemical, the UK government was negotiating a better base rate than the German government.
Okay, let's use a car analogy. The UK was buying the brand new Ferrari. Germany was buying the 10-year-old used minivan.
Okay, yeah.
Of course, the raw price of the Ferrari is higher. But what you were saying is the UK was actually getting a fantastic below-market deal on that Ferrari, while Germany was overpaying for the minivan.
That is exactly what the math shows. And when we apply the same quality adjustment to the other countries, France, Italy, Spain, another massive truth is revealed.
That's that.
When we adjust for quality, the prices between those cheap southern countries and Germany actually narrowed drastically over the decade.
So the market is converging. The European Union's dream of a single price is actually secretly coming true underneath the raw data.
The numbers are undeniable. The adjusted price difference between France and Germany decreased by 40%.
Yeah.
Spain decreased by 50%. Italy decreased by an astonishing 65%. The massive yawning gaps in price are collapsing.
So if prices are unifying, what invisible hand is actually pushing them together? Did the cheap countries like Spain and Italy suddenly get richer and raise their prices to meet Germany?
No. And that is the ultimate ironic twist of this entire paper.
Hit me.
The cheap countries did not catch up. The convergence was driven from the top down by what we can only describe as an ironic corporate collusion.
How does that work? How do corporations force convergence without raising prices?
The pharmaceutical companies quietly lowered the relative quality of their offerings in Germany to match the rest of Europe.
Wait, they made the German drugs worse? Medically worse?
Not medically worse. The chemical is the same. They made them economically worse.
I see.
They manipulated the exact variables we just spent time discussing. They massively increased the use of huge bulk pack sizes in Germany.
Oh, remember our rule. Big cardboard boxes mean cheap per unit prices.
Exactly. They changed the packaging discounts. They unified the European prices by aggressively watering down the premium German market with bulk cardboard.
So pharma companies couldn't force the Spanish or Italian governments to pay more for a pill.
Right.
So instead, they forced Germany's average price down by flooding the German pharmacies with massive bulk boxes.
Look at the exact data from the researchers' decomposition model. Of the 18 percentage point convergence in price between France and Germany, 16 of those points are directly attributable to these quality shifts relative to Germany.
Almost the whole thing.
In Italy, it's 34 out of 44 points of convergence. In Spain, 19 out of 33 points.
It is entirely driven by the companies manipulating the physical presentation of the drug, not the chemical, the box.
The pharmaceutical companies have been largely responsible for European drug price convergence, not the politicians shaking hands in Brussels, the corporations manipulating spreadsheets.
And they did it by lowering the quality profile in the most expensive country.
It is a brilliant, terrifying strategy. But something else happened during this 10-year timeline. A massive, violent disruption that threw gasoline on the fire of this convergence.
We need to talk about the year 2000 shock and the multi-billion-euro gray storm.
We must talk about the smugglers, the arbitrage traders.
Every single day, millions of boxes of medicine are stuffed into the back of trucks and shuttled across European borders in a massive arbitrage scheme. Is this saving lives, or is it destroying the market?
Let's start with the trigger event, the policy assassination that happened in the year 2000.
What exactly did Germany do in the year 2000?
Germany changed a single formula in its complex reference pricing system. It was a bureaucratic mathematical tweak.
What was the tweak?
They vastly increased the required price discounts for large pack sizes. They basically said, if you want to sell bulk boxes here, you have to give us a much steeper discount.
A tiny change in a spreadsheet in an office in Berlin.
The impact was a seismic shockwave across the continent. The researchers noticed it in their data instantly.
What did the data do?
The pack size regression coefficient for Germany plunged off a cliff between 1999 and 2000. That one mathematical tweak instantly reshaped the entire European supply structure.
It drove the German average price down violently.
And permanently. But the real chaos, the real street-level disruption was happening at the borders. The parallel import storm.
This is pure, unadulterated, brutal capitalism.
Yeah.
Arbitrage, buying low and selling high.
Exactly. Because the European Union fundamentally mandates the free movement of goods across its borders. It is completely legal to buy a product in one EU country and sell it in another.
Even life-saving cardiovascular medicine.
Especially medicine. Traders look at the raw price gap we discussed at the very beginning. They look at a computer screen and see that a specific heart pill costs 24 cents in Spain.
Right.
Then they look at another screen and see that the exact same pill, made by the exact same company, sells for €1.36 in the UK.
So they buy 1 million pills in Spain, they load them onto a truck, they drive them across the border, put them on a ferry to London, and sell them to a British pharmacy for a massive profit.
It is a gray market. It operates in the shadows of the official supply chains, but it is entirely legal. And the scale of this operation is staggering. By 2003, this parallel import market hit €4.26 billion.
4.2 billion euros of heart pills moving in the shadows.
It represented 5% of the total European Union pharmaceutical market value.
5% of all drugs are being shuttled around by arbitrage traders. That is massive.
Look at the UK specifically, because they were the primary target for these traders due to their high prices.
Yeah.
In 2005, 1 out of every 17 prescriptions filled in the United Kingdom was a parallel imported drug. It accounted for 1/7 of their total sales value.
1 in 17. Think about that. If you go to a British pharmacy to get your grandfather's heart medicine, there's a massive chance the box that the pharmacist hands you was originally printed in Spanish.
Or time.
Bought by a trader, stuffed in a truck, and shipped across the continent.
Often they're actually repackaged. The European Agency for the Evaluation of Medicinal Products, the EMEA, harmonized the dosage and labeling requirements to make things safer.
Well, that's good, right?
But this accidentally made repackaging cheaper and easier for the smugglers. The EU's attempt to standardize safety inadvertently poured gasoline on the gray market. They made it easier to swap the boxes.
So these traders are basically bleeding the system. They are stealing profit from the pharmaceutical companies and disrupting national supplies.
Or you can look at it another way. They are the ultimate forcing function for the single market.
How so?
Think about it. This gray market completely bypasses the national governments. It bypasses the slow-moving pricing boards. It bypasses the pharma executives in their boardrooms.
It's just raw market forces.
It uses pure, ruthless, capitalistic arbitrage to bleed the high-price countries until the manufacturers are forced to lower their prices to match the rest of Europe.
It is vigilante market convergence. The traders are doing what the politicians couldn't.
The data supports that view. Research by Ganslant and Maskus in 2004 found that prices of drugs subject to parallel import competition fell by 12 to 19% compared to other drugs.
The gray market forces prices down in the expensive countries.
It is destroying the geographic monopolies that pharma companies try to build.
But wait, even with the smugglers, even with the corporate manipulation of box sizes, there is still a gap left over in our data.
There is.
The statistical models, the quality adjustments, the competition variables. Wait, I shouldn't say ... The models couldn't explain absolutely everything.
You are right. We have to address the ghost in the machine.
What is the ghost? If the math is perfect, why is there a gap?
The researchers call it the ghost of policy residuals. They found an unexplainable price gap.
Even after all that.
Even after you rigorously adjust for the size of the cardboard box, the age of the drug molecule, the strength of the chemical, and the swarm of generic competitors.
Right.
Even after you account for the billions of euros moved by parallel importers, a stubborn gap remains between the nations.
Why? What is causing it?
Because human behavior is not perfect, and institutions have deep, stubborn memories. These are institutional habits that refuse to die, no matter what the math says.
Give me a tangible example of an institutional habit.
Local doctors prescribing quirks. A German doctor might simply trust a specific brand of beta blocker more than an Italian doctor, based purely on what they learned in medical school 20 years ago.
That makes sense.
Then you have unique insurance coverage limits, different cultural attitudes toward preventative medicine. In France, there are specific targets for general practitioners to act as gatekeepers before referring to specialists.
Right.
In Spain, there are strict negative lists of drugs they absolutely refuse to reimburse under any circumstances.
The culture of healthcare itself creates a price floor. You cannot mathematically model a doctor's gut feeling or a patient's cultural preference for a pill over a liquid.
You cannot. And that unexplainable residual is why the market will never, ever be perfectly flat. The institutional memory of a nation's healthcare system is simply too heavy.
A single market requires a single culture.
And Europe does not have that.
So, we have reached the end of our autopsy. Let's pull back and look at the whole body on the table. the grand vision of unified European medicine market.
We have seen the illusion. It isn't being built by politicians shaking hands in Brussels and signing treaties.
No, it is being forged in the shadows. It is being built through manipulated cardboard box sizes, through strategic paperwork delays in French patent offices,
Yeah.
through a multi-billion-dollar gray market of pill smugglers who are forcing price convergence against the active will of both national governments and massive corporations.
It is a system built entirely on contradictions. The European Union demands a single market, but it allows sovereign health policies to dictate terms.
Exactly.
Pharmaceutical companies demand global reach, but they actively exploit national borders to maintain profit margins.
The next time you pick up a prescription, I want you to look closely at the box, look at the cardboard, realize that the price you pay at the register is the casualty of a silent war.
A very expensive war.
A war between national health monopolies trying to save budgets and global drug patents trying to maximize returns. Every single millimeter of that cardboard packaging has been mathematically calculated in a global game of leverage.
It's all calculated.
And your health, your need to keep your heart beating, is the collateral they use to negotiate.
It is a house of cards. And the stakes are only getting higher. Which leads to a terrifying final thought based on this research.
The European Union has unparalleled, coordinated political power. Yet, it took them decades just to begin aligning the price of basic, older cardiovascular pills. Simple chemistry.
Right.
Pills that have been around for 20 years and are relatively cheap to manufacture.
As we enter the modern era, we are moving away from simple chemistry. We are entering the era of million-dollar personalized gene therapies. We are entering the era of AI-crafted drugs that are custom-tailored for a single patient's DNA profile.
If the combined power of Europe could not quickly unify the price of a basic heart pill in 10 years, how can any government hope to regulate the prices of these personalized million-dollar cures?
They will be paralyzed. If a generic copycat is impossible because the drug is tailored to your specific DNA, the leverage completely vanishes.
Will the ultimate cures of tomorrow be hopelessly trapped behind the very borders we claim to have erased? Will your geographic location or the bureaucratic efficiency of your local patent office dictate whether you have access to the future of human survival?
It is a terrifying prospect. The invisible walls might be getting higher, not lower.
Same drug, same continent. Across an invisible line on a map, the price explodes. The X-ray machine of public policies is broken, and the diagnostic muddy waters are deeper than ever. Keep questioning the cardboard box. Keep questioning the data. We'll see you in the deep end.